Antenatal care is one of the largest and most overwhelming modules in Part 3 MRCOG syllabus. In this single module, you're expected to cover opioid abuse, substance misuse, domestic violence, safeguarding concerns, female genital mutilation, preterm labor, prom, extreme prematurity, breaking bad news in IUFD stations. On top of all of this fetal anomalies would come. Then people would ask me that, oh my god, this is very overwhelming, because you need to read about the structural anomalies, genetic conditions such as echogenic bowel, urinary tract anomalies, polycystic kidneys, congenital talipes, congenital diaphragmatic hernia, brain anomalies such as anal chiari malformations, and many more. This is an extensive list. And students often stop me and ask, how do we remember all of this? This feels overwhelming. The answer is you don't need to. In Part 3, you're not being tested on rare diagnosis. You're being tested on whether you're safe, structured, and communicative. If you are given an unknown anomaly in the exam, say for example, you are being given anal chiari malformation or polycystic kidney disease, you don't know anything about this particular condition. Still, you can pass this station. Trust me, guys. Always think in domains, not the diagnosis. Forget about the diagnosis. If you are given an unknown anomaly in the exam, domain-wise. First, information gathering. You can always ask your routine questions, her pregnancy, previous pregnancy, medical conditions, surgeries, allergies, that, this, and you can always ask the family history of any genetic conditions in her family line, the partner's family line. All those definitely you will cover, right? So this way you will be getting marks in information gathering because you have asked many questions related to this, including the congenital, genetic conditions, infections, many more. So you always score well in the information gathering. Coming to the second domain, which is communication with the patient. So this is not the diagnosis or the information the patient expected. So you need to have the breaking bad news template. You need to offer her the support and confirm the scan findings. And then you need to tell her by giving a warning shot. And keep your language simple. If something brain anomaly is given, just tell that there is this issue with the development of the brain. As simple as that. Issue related to the development of the kidneys. As simple as that. You don't have to give her any complex information. Okay, you can say, I'm afraid this is difficult news. The scan suggests there is this problem with the development of the kidneys. You can always draw and show her and keep it simple. You do not need any medical jargons, and that way definitely you will get decent marks, at least borderline to the pass marks in the communication with the patient, because you followed the breaking bad news template and you offered her the support. You were being safe by confirming the scan reports, and you use the diagrams to explain her in a simple medical jargon free language, and you paused and you allowed her to express emotions, and you also told her not to blame herself. This is nothing you could or you couldn't have done to prevent this from happening. This is related to the development and this is a rare entity altogether. So just by saying this, irrespective of the anomalies, you would get marks in communication with the patient. And the third domain is applied clinical knowledge. So you can safely say that some anomalies are isolated and some may be associated with genetic conditions. And this cannot be confirmed on a screening scan alone. We need a detailed specialist input. Are you the expert? No. Then comes your communication with the colleagues. So this is very high yield domain in this stations. Always involve a fetal medicine specialist, genetic counselor, and offer psychological support in the form of counselors. Even if you know nothing about the condition, this alone scores the marks. So you can tell us that, I'm not the expert. We need to involve the expert team in here in order to understand what's really going on. We need to have a detailed scans, isn't it? Just by saying this, you will get communication with the colleagues domain pass. And the last one is patient safety and the planning. Offer further tests such as detailed scan by the specialist team at fetal medicine unit. If appropriate, invasive testings. Say for example, you're dealing with congenital diaphragmatic hernia. It could be associated with Down syndrome and other genetic conditions. It could be associated with some heart issues. So, in order to understand, we need to have a definitive test. Always offer, do not suggest, that we can offer further invasive tests such as amniocentesis or chorionic villus sampling, depending upon what gestation she has come in with the anomalies. So that will make it clear whether it is associated with the genetic conditions. If so, then the management is bit different, or it could be complex in that scenario. And always reassure her that the decision is entirely hers. She can decide what is best for her, and she can tell us what to do about it. And we always respect her wishes. And finally, discuss the options gently. So irrespective of what anomaly you get in the exam, depending upon the findings, is it an isolated structural anomaly that can be correctable, or it is associated with any genetic conditions? If based on what we find, we always tell her she can choose to continue, not to continue the pregnancy, and her wishes will always be respected. Okay? And if she chooses to continue the pregnancy, then her care is going to be under consultant-led care unit with a regular follow-up. So remember, you can pass an anomaly station, unknown anomaly station, even if you don't know anything about that anomaly, as long as you try to cover the points under domains. So be safe and structured and kind to the role player. Definitely you will pass this station with good marks. All right? All the very best.